talk about consent briefly for a second. Now, when you're doing a standard clinical examination, cardiac exam and abdominal examination, you don't think twice about the need for consent. But when it comes to particularly invasive or sensitive examinations, for example, a breast examination, a vaginal examination, or a rectal examination, you absolutely make sure that your consent is perfectly on point. When it comes to psychiatric consent, it seems there can be a bit of a grey zone there, speaking with students. And I really want to double down on that at the moment. If you are doing a mental state examination on a patient, the phrase is in the name, it's an examination. If you aren't getting consent and explaining what is going on, technically you're committing battery. You must adequately get consent, i.e. the patient must know what's going on before you do an examination. So rather than just saying you should do it, how would I actually go about it? So in order to get consent for a patient where I wanted to do a mental state examination, I'd say, hello, my name's Dr. Gill. Can I confirm your name and date of birth, please? Once we'd established that, I'd say, I would like to do a mental state examination. That's going to involve me asking questions and listening to you with regard to thinking about what's going on with your thoughts, your feeling, your mood, behaviour, and potentially actions. And during that, I'm going to be taking notes. Are you happy for me to proceed with regard to that? And that should hopefully mean that the patient has heard I'm going to be looking at what's going on with their mind, how they're thinking. And here's the crucial bit. It's actively now in this moment in time. Hence, it's an examination. That's different from the psychiatric history, which might be what's led up the patient coming here today. So you may have to take your consent twice. Once to have a conversation about the things that have led up to them sitting in front of you for the consultation, but also the consent to have a look into their thought processes, into the functioning of their mind at that moment in time for the mental state examination. Hopefully that clears up this very important bit of phrasing, for want of a better phrase. Take care, and I'll see you in the next one. Cheerio.